This is the laboratory interpretation guide for the Destiny Well Toxic Elements Plus profile. This includes toxic elements plus nutritional elements that are vital for health. Toxic metals are important. The body has great difficulty getting rid of them, and they accumulate over a lifetime. Bioaccumulation up the food chain is also important. If algae in the sea have a tiny amount, and the small fish that eat them have a little bit more, then the bigger fish that eat them have more still. They concentrate things as you get up to larger predatory fish. So be careful when you're selecting what kinds of fish or what kinds of mammals to eat in terms of the bioaccumulation risk for toxic metals and other toxic elements. Toxic metals also can interfere with mitochondria, the cell's powerhouses that produce most of our energy, and they can interfere with key enzyme systems throughout the body. The accumulation of toxic metals in the body is associated with a host of diseases, from ADHD and autism to Alzheimer's and thyroid dysfunction. Nutritional metals are vital. The nutritional metals zinc, copper, selenium, and the element iodine are critical for health. They are incorporated into the working center of many enzyme systems that create energy, into hormones, and they also perform many other vital functions. A certain amount is needed, but too much can be toxic. Bromine is a unique element in that it is required in very small amounts, but most of the concern with it is with significant exposures it can substitute for iodine and interfere with the formation of thyroid hormone and cause toxicity in that and other ways. At Destiny Well, we define laboratory ranges in a sophisticated way. We use the standard ranges, represented by the blue bar here, from each reference lab that does a particular test to define the lab high and the lab low. If you have thyroid test results that are too low based on the lab's formal norm, then you have a diagnosis of lab low thyroid function or hypothyroidism. Similarly, for glucose, if you have a lab high blood sugar of over 126 on 2 occasions, then you meet the formal diagnosis criteria for diabetes. That's needed to make a medical diagnosis. But at Destiny Well, we think that there can be a lot more nuance. We believe that there's often an optimal range based on what we have found going forward helps people to live the healthiest lives, to be the healthiest, and to avoid disease. We triangulate this with the medical literature, with other people's standards, with our clinical practice experience, and all the different data points we can get, so we can come up with what we believe is optimal for a particular test result. Destiny Well also, in the red bars here, will define a Destiny Well high and a Destiny Well low. These may or may not line up exactly with a laboratory high or low, because sometimes we think that the range can be higher or lower, or that it needs to be different. And in between the optimal and the green bar and the low and the high and the red bars, we have orange zones for moderately high and moderately low. They're not quite optimal, but they're not in the high or low zone. Toxic metal or mineral levels above normal are potentially serious. We advise you to work closely with your doctor or medical team to address this potentially serious problem as soon as possible. Lead is one of the toxic metals we've heard a lot about in recent years. It's contaminated water supplies in schools and whole cities. Lead is damaging to the nervous system, and it's especially bad for younger children with developing brains. It can also cause anemia, nausea, and other symptoms. The reference lab range is 0 to greater than 2.50 micrograms per deciliter. Destiny Well optimal is 0. Lead is not needed for anything in the body, and the less the better. Moderately high is 0 to 2.5, and greater than 2.5 is considered definitely abnormal. Exposure to lead comes from lead pipes and lead paints. Older houses had lead paints, and the dust would flake off. Children and animals and people who got exposed to that dust, especially kids who would eat things on the floor, would get higher exposure to lead. Welding is another way that people can get exposed to lead. Many solders have lead in them, and that's vaporized during the solder process and can be inhaled. As we said, lead can cause anemia, nausea, neurotoxicity, and developmental delay in growing children. Symptoms of lead toxicity include insomnia or problems sleeping, delirium or confusional states, problems thinking or cognitive defects, and tremor. Hallucinations and seizures, convulsions are also possible. Symptoms may be different in adults and children. Abdominal pain, memory loss, and kidney failure can occur in adults, along with headache, weakness, and pain or tingling in the extremities. Early symptoms of lead poisoning in adults are very nonspecific, and they may include sort of general depression and loss of appetite, intermittent GI symptoms such as nausea, diarrhea, constipation, or intermittent abdominal pain, and muscle pain. Other signs in adults include just loss of interest, malaise, fatigue, and decreased libido, as well as problems with sleep. An unusual taste in the mouth and personality changes are also early signs. In adults, symptoms can occur anytime levels get above 40 micrograms per deciliter, but are more likely to occur at levels above 50 to 60 micrograms per deciliter. In children, symptoms begin to appear generally around 60 micrograms per deciliter. Mercury is one of the most feared toxic elements. It builds up in the system insidiously, and it interferes with enzyme systems and things like the thyroid. It's very strongly neurotoxic, and you've probably heard the expression from days on old, mad as a hatter. Well, the industry in making hats, especially back in England, used to use mercury, and the people who worked with that occupationally would get high levels of mercury. Dentists have gotten high levels of mercury exposure over the years because many fillings are mercury of the old silver type. Mercury is measured in this profile in both the blood spot and in the urine. The range for mercury in the blood is from 0 to 5.37, again with a toxic metal. The optimal level is 0. Moderately high is 0 to 5.37. And greater than 5.37 is considered definitely toxic for a mercury blood spot reading. Mercury in the urine, again, it goes from 0 to 1.58 micrograms per gram of creatinine in the urine. And ideal, again, is 0. 0 to 1.5 is mildly high, and greater than 1.5 is in the toxic range. How do we get exposed to mercury? Well, mercury is in silver dental fillings, so it's good to consider removing them because they continue to release mercury into the body that's absorbed. Many fish that are high in the food chain build up mercury, and when we eat them, it builds up in our body. Tuna and large predatory fish like king mackerel, marlin, orange roughy, shark, and swordfish are especially high. Insecticides sometimes contain mercury, as do some preservatives for vaccines. Inorganic mercury, the kind that was in the old thermometers that would occasionally break and roll around, is not really all that toxic. But if it sits around or it's exposed to biologic systems or bacteria, then it gets organified. That means methyl or ethyl groups get attached to it. Methyl and ethyl mercury are highly toxic, absorbed into the system, and build up in the body. They're toxic to the brain, they affect cognitive function, there can be neuropsychiatric problems like depression or thought disorders. They affect enzyme systems all over the body and also can be toxic to many different organs, including the heart, the lungs, the kidneys, and the immune system. Cadmium is another toxic metal that's checked on the Destiny Well Plus toxic profile. Cadmium is measured in the urine and in blood spot. In the urine, the normal range is from 0 to 7.2. Again, optimal is none at all. Mildly high is 0 to 0.72, and above 0.72 would be considered into the toxic range. For the blood spot, 0 again is normal and 0 is optimal. 0 to 1.03 micrograms per liter is considered mildly elevated, and above 1.03 micrograms per liter would be in the toxic range. Well, where do we get exposed to cadmium? Well, we get it from industrial waste and from living near factories or working in industrial processes that use cadmium. Smokers get exposed to cadmium through the tobacco products they use. There's also cadmium in food and water and meats. Symptoms of cadmium toxicity include respiratory distress, especially when it's inhaled, kidney failure, and weak, brittle, and painful bones. Worldwide, arsenic is a very common toxic exposure. Some calculations show that around the world, it's the element most responsible for a decrease in IQ from neurologic damage. The laboratory range for arsenic is from 0 to 42 micrograms per gram of creatinine in the urine. Arsenic is generally measured in the urine because it's excreted through the kidneys and is very toxic to the kidneys. The desirable amount of arsenic is 0. The range between 0 and 42 is considered mildly elevated, and greater than 42 is considered toxic. We get exposure to arsenic through water and through food. Rice is an especially common way to get exposed because it tends to take up and concentrate arsenic. Acute symptoms of arsenic poisoning start with headaches, confusion, diarrhea, and drowsiness. This progresses to vomiting blood, and blood in the urine, muscle cramping and stomach pain, and more convulsions. The organs most affected by arsenic poisoning are lungs, skin, kidneys, and liver. The final result of arsenic poisoning, if it progresses, is coma and death. Low-grade to moderate arsenic poisoning is also related to an increased risk of heart disease, especially high blood pressure-related cardiovascular disease, including heart attack and stroke. Lower respiratory diseases like emphysema and asthma can be increased, as can diabetes. Vitamin A deficiency with night blindness is also associated with arsenic exposure. Arsenic increases the risk of several types of cancer, particularly skin cancer, lung cancer, liver cancer, and kidney cancer. When we measure metals in the urine, it's important to know how concentrated or dilute the urine is. So we measure a substance called creatinine, which is a test that we often use for kidney function. If we compare the amount of a metal or other toxic substance in the urine, the concentration of the metal compared to the concentration of the creatinine that's excreted as a byproduct of muscle metabolism, we can tell and correct for the dilution or the concentration of the urine, so we can compare one specimen to another and to normal values. Iodine is another critical element. It's important nutritionally, especially for thyroid function, but many cells in the body need it. Adequate iodine prevents breast cysts and may lower the risk of breast cancer. The therapeutic range for iodine from the reference lab is a low of 100 micrograms per gram of creatinine and a high of 380 micrograms per gram of creatinine. The Destiny Well optimal zone, the green zone is 150 to 300, mildly low 100 to 149, low less than 100, mildly high 301 to 380, and high over 380. Iodine deficiency used to be prominent in the central area of the United States and is still prominent in several areas around the world, especially inland from the sea, where people don't eat much seafood or get exposure to sea products like kelp and algae. Iodine deficiency leads to thyroid enlargement, sometimes called goiter. It can also lead to mental imbalances such as depression and anxiety, mental retardation, and in extreme cases, and particularly from children of mothers who had iodine deficiency during pregnancy, fetal hypothyroidism, which is improper functioning of the thyroid gland in unborn children, can lead to severe brain damage. Autism may also be increased in people who have iodine deficiency. You can also have too much iodine. Iodine toxicity includes autoimmune phenomenon, so people given iodine, especially before they get adequate selenium in the diet, can have damage to the thyroid gland and other areas. Hypothyroidism or hyperthyroidism, either low or high function of the thyroid gland, can happen when patients are given supraphysiologic iodine exposure. That means very high doses of iodine, which either could be subclinical, where they don't have any symptoms, or they actually could have overt or visible signs and symptoms of thyroid problems. The source of excess iodine might not be readily apparent. Sometimes it's in different medicines that people don't know they're taking. Sometimes they take a combination of medicines or other things that result in high exposure to iodine. Bromine is generally considered a toxic element, but recent research has shown that it's needed for at least the formation of one type of collagen protein in the human body. The reference lab range for bromine is less than 700 micrograms per gram of creatinine on the low side and greater than 4,800 micrograms per gram of creatinine on the high side, thus making the ideal range somewhere between 700 and 4,800 micrograms. In general, we believe toward the lower end of that would probably be better. It may be important to check bromine levels if you have a thyroid problem. Bromine is a very similar and chemically related element to iodine. Iodine is needed in several molecules for each molecule of thyroid hormone that's created. Bromine can try to substitute for iodine, which does two things. It may decrease the effectiveness of the formation of thyroid hormone, or the molecule of bromine may actually get substituted for the molecule of iodine, making it a less functional and less effective thyroid hormone molecule. Exposure to bromine long-term can cause serious poisoning, especially if it's inhaled. It can cause long-term lung damage. And people who survive serious bromine poisoning may also have long-term effects from damage to the kidneys and the brain, and also damage from low blood pressure. We get bromine exposure from breads. It's added to breads as a leavening agent. It's also added to swimming pools instead of chlorine, sometimes for sterilization, and it's present in some medicines as well as through food and water. We talked about bromine displacing iodine in thyroid, but actually bromine increases the risk of cancer in the breast, the thyroid gland, the ovary, and the prostate, cancers that we're all seeing at increasingly high rates today. Selenium is an important nutritional element that is absent in soil some places. Many good multivitamins have selenium in them. We measure selenium both by blood spot and in urine. The reference lab range for selenium blood spot is from 170 micrograms per liter to 318 micrograms per liter. The decibel optimal is in the middle of this zone from between 170 to 318. The selenium urine values show that a normal range for the reference laboratory is between 34 micrograms per liter and 220 micrograms per liter. We feel that the optimal range for selenium in the urine is between 50 and 175 micrograms per gram of creatinine in the urine. That too low is less than 34, moderately low is 34 to 49, moderately high is 176 to 220, and greater than 220 is definitely too high. Selenium reduces inflammation in the body to some extent. It also has an antioxidant activity that may help to reduce the risk of cognitive or mental decline as people get older. However, results from research studies are mixed, so selenium supplements are not specifically recommended for this, especially since other metals such as lithium and magnesium have been proven to help this more than selenium does. Thyroid disorders, selenium has an important role in both producing and metabolizing thyroid hormone. There's evidence that women with higher selenium levels have fewer thyroid problems, but this hasn't been proven for men, and other studies have produced conflicting results. Selenium does play a role in cancer because it helps with DNA repair and other functions that may mean that it can prevent some types of cancers. Again, however, research studies are mixed. Some show help, some show harm, some show no effect at all. In general, we want to get adequate levels of selenium because it's important for critical enzymes. It helps make glutathione, which is one of the body's main intracellular antioxidants, and it's important both to protect the thyroid and in the formation of thyroid hormone. Signs of selenium toxicity include a garlic-like smell on the breath and a metallic taste in the mouth, brittle nails, mottled or decaying teeth, and GI problems such as nausea. Fatigue and irritability are also common, and skin lesions and skin rashes as well as hair loss can occur. Magnesium is very important for both nervous system and heart function, and it's used in enzyme systems all over the body. The normal reference laboratory range for magnesium is less than 36 micrograms per liter on the low side and greater than 57 micrograms per liter on the high side. It tends not to be very toxic in most people when they take it orally, if their kidney function is normal and they can excrete it. The decibel optimal zone is between 36 and 57. Serum levels are not as reliable as tissue levels, but it's hard to measure what's going on inside the cells, and so we rely on magnesium blood levels to give us at least a reflection of that. Zinc is an element that has anti-inflammatory effects and is involved with enzyme systems throughout the body. It also is very helpful for the immune system and is critical in the formation of both blood and thyroid hormone. The reference lab range for zinc is 6.35 milligrams per liter on the low side to 9.35 milligrams per liter on the high side. The Destiny Well optimal zone is 6.35 to 9.35. Copper is another essential element, but like many elements, you can get too much of it and get copper toxicity. Copper is needed for the formation of red blood cells, and zinc and copper compete for absorption. So if you take too much zinc in, you may not get enough copper. Iron also comes into this equation, as it also competes for absorption with these other two. Copper, under certain circumstances, can be toxic to the nervous system, so it's important not to get too much. The Destiny Well laboratory reference range for copper is 0.79 milligrams per liter on the low end and 1.14 milligrams per liter on the high end. Destiny Well optimal green zone is 0.79 to 1.14 milligrams per liter. Copper is another nutritional metal that's needed for many functions in the body. It's important for the nervous system, but too much copper can actually be neurotoxic. It's important for bone and musculoskeletal health, as well as for the production of hemoglobin and red blood cells. It's important for metabolism in the way the body uses iron and processes oxygen for fuel. Copper is important in many parts of the body. The body can't store it very well, so we need to keep taking it in foods. Nuts and seafoods like oyster, certain meats like liver, and seeds, beans, and grains are all good sources, along with seafood and fish. Vegetables may also have some copper. Copper is needed for the maintenance of many different parts of the body, including the musculoskeletal system in particular. You've seen people wearing copper bracelets, and it's said to help musculoskeletal problems of many types. When people are deficient in copper, they can get more musculoskeletal pain. Signs of copper deficiency include musculoskeletal problems like arthritis and osteoporosis, thinning of the bones or brittle bones. Fatigue is common, as is low body temperature or always feeling cold, as in with hypothyroidism. Anemia can occur, as well as frequent illnesses when the immune system is not functioning fully. Also, stunted growth can happen in children, hair thinning or balding, unexplained weight loss, and skin problems such as inflammation or sores, along with increased bruising. Symptoms of copper excess can include fatigue, headaches, migraine, nervous system symptoms, and psychiatric symptoms such as despair, suicidal feelings, hopelessness, or paranoia. People, in addition to depression, can have symptoms like hypothyroidism with cold hands or feet. Sometimes the heart will race, and people will have problems with concentration and memory. Panic attacks and high anxiety are also common, as are some things indicative of immune system dysfunction, like frequent yeast infections. Aching muscles, low blood sugar, and premenstrual syndrome have also been reported. Symptoms of zinc deficiency can show up all over the body. Loss of appetite and loss of taste are common, and zinc supplementation has been reported in some circumstances to improve this. Cognitive function is also dependent on zinc and impaired when there is zinc deficiency. Moderate to more severe zinc deficiencies can also be associated with things like depression, fatigue, irritability, and general lethargy. Zinc supplementation may provide very rapid improvement in these types of situations and has even been reported to improve symptoms of ADHD, attention deficit hyperactivity disorder, and depression. The role in depression is especially interesting because there's increasing evidence that suggests that zinc deficiency plays a role in depression and that zinc supplementation may be an effective treatment, or at least part of treatment, for major depression. It's important for growth in children and important during the prenatal period for the development of the fetus. Zinc toxicity can occur both with acute overdose and chronic overexposure. Such toxic levels can happen as zinc ingestions of over 225 milligrams at one time, or chronically elevated intake of zinc. Zinc is generally well tolerated and is used in things like the AREDS, AREDS formula to prevent macular degeneration, along with certain vitamins and other substances such as lutein and zeaxanthin. Zinc has also been used in lozenges such as zinc gluconate and zinc acetate to treat viral infections and the common cold. When people are deficient in zinc, their taste is impaired, and replacement of zinc can help improve taste. Zinc competes with copper for absorption, and they both compete with iron. So high ingestion of zinc can lead to copper deficiency, and copper deficiency has been associated with neurologic problems and especially with anemia. It's usually easy to fix just by stopping the zinc and giving some copper or copper-rich foods like nuts. The zinc to copper ratio can be an important ratio to measure. In general, we get too much copper as time goes on, and our body doesn't get rid of it as well. Copper comes from increased oxidative stress as well as from the diet. Zinc is an important mineral, but overingestion of zinc can impair the absorption of copper and lead to things like anemia. Overall, we think less copper is better, so we generally advise avoidance of vitamins that have copper in them, although some vitamins will have copper and zinc in them with a ratio of 7.5 to 15 zinc for every 1 of copper. This is in order to try to prevent the anemia that can occur with chronic zinc ingestion. Our preference, however, is to take just the zinc because we feel you get enough copper in the diet most of the time, and then to monitor periodically. If the zinc to copper ratio goes up too much and you're not getting enough copper, then you can either take a product with copper in it or you can stop the zinc for a while. Tests included in the Destiny Well Toxic Elements Plus profile include blood lead level, blood and urine mercury levels, urine arsenic level, blood and urine cadmium levels, urine iodine level, urine bromine level, blood and urine selenium levels, blood magnesium level, blood zinc, blood copper, and blood-derived zinc to copper ratio from those 2 blood tests of zinc and copper. Toxic metals can have devastating effects. They can be toxic to the nervous system, damage the bone marrow, interfere with detoxification pathways in the liver and kidneys, and also interfere with the production and function of key hormones. The first step to getting ahead of them is to find out where you stand, and this profile checks the levels of the 4 key heavy metals that can cause toxicity. At Destiny Well, we've been extremely fortunate to find some amazingly good coaches, people with backgrounds of success in varied fields who bring all sorts of resources and talent and skill to help you. These folks have many years of clinical experience, and they know how to be of assistance at every step of the way, from motivation to connecting you with the right resources to finding things that you need to get you on your journey. To learn more, go to destinywell.com/coaching to meet our team and find out how they can be of service to you.